Anxiety Explained: How to Better Understand, Identify, Acknowledge, and Manage Troublesome Anxiety. In the context of this resource, we'll be focusing on definitions of anxiety and related concepts, the features of anxiety, the neurobiology of anxiety, anxiety disorders, other conditions featuring prominent anxiety, the management of anxiety, when to seek professional help, and treatment options. In everyday conversation, we use the language of emotions that we're comfortable with. Which of the following words do you relate to? Anxiety, stress, panic, apprehension, fear, or perhaps terror? Although emotional and physical responses are similar across all of these states, there are subtle and not so subtle differences between feeling stressed, becoming anxious, panicking, and becoming frozen by fear. For the purposes of this resource, I will be focusing on the concept of anxiety. But what is anxiety? Let's begin by defining our terms and clarifying what we mean exactly by anxiety compared to other related concepts. First, we'll look at the definition of stress. A stressor is anything around us that we perceive to be threatening or challenging. Stress is our body's physiological reaction to a stressor. It's characterized primarily by the release of adrenaline and the activation of the fight or flight response. The most common sensations associated with a fight or flight response are rapid breathing, increased heart rate and blood pressure, muscle tension, especially chest tightness, stomach tightness, butterflies, nausea, a dizzy sensation, perspiration, lightheadedness, and numbness or tingling in your extremities like your toes or your hands, and sometimes even your face. These sensations are all manifestations of your brain trying to prepare you to effectively manage a threat by either running away or fighting. Fear. Fear is an emotion that usually arises in response to a specific, observable threat or danger. Fear is strongly associated with fight or flight responses. It may also involve the narrowing of your attention onto the specific threat. It is often accompanied by thoughts about immediate danger and escape behaviors. Fear usually disappears quickly and may subside dramatically once the source of the fear is removed. The fear reaction is likely to appear rational in response to a threat, so it represents a reasonable evaluation of the threat encountered. Anxiety. Anxiety is similar to fear. It's an emotion that comes about in response to the perception of a threat or a danger. However, it tends to involve the anticipation of an imagined, unrealistic, unclear, or diffuse future threat, and it manifests in a more persistent long-term pattern of vigilance. A key aspect of anxiety, then, is uncertainty. Anxiety often comes with the broadening of attention in anticipation of or attempts to detect the threat. It's also associated with muscle tension. Anxiety is likely to be accompanied by caution and avoidance behavior. I'll give you some examples. After watching a nature documentary about the most dangerous snake on the planet, you begin to decline invitations to go hiking, imagining that you could encounter and get attacked by a snake. Soon you avoid remote areas of the park, golf courses, lakes, even zoos. You find yourself spending a lot of time planning your days so as to avoid any possibility of encountering a snake. Another example, you're feeling anxious while you're at home alone at night. Every time you hear the phone ring or the wind push against the door, you begin scanning your environment in anticipation of something threatening happening soon. Your anxiety will likely remain fairly constant, with little ups and downs as you evaluate each new cue, for example, the ringing phone. So just to summarize, anxiety then is an emotion. It's an emotion that's related to fear. Anxiety is different from fear in that it is typically future-orientated, prolonged, and essentially irrational in nature. The main function of anxiety is to act as a signal of danger and threat and to trigger the appropriate responses. Anxiety has many different features. It can produce a range of symptoms, experiences that can be classified as physical in the sense of bodily sensations, cognitive, meaning any mental or intellectual phenomena such as thought, emotions, this relates to feelings, and behavioral features. This is seen in the things that you do. Anxiety does not necessarily manifest in the same ways in yourself as it does in others. It's useful to get to know some common signs and symptoms of anxiety in yourself. Identifying anxiety may be the first step in learning how to manage it more effectively. Anxiety can occur across a range of severity. On the mild end of the spectrum, a flutter in your tummy, slight tension in your muscles, and a little bit of emotional jitteriness may signal anxiety. When your anxiety approaches moderate levels, you may feel on edge and less confident. At the extreme end of the spectrum, you may end up feeling as if you're unable to think clearly. You may feel sweaty, agitated, tense, and become entirely unproductive. We'll now look in more detail at the features of anxiety. Among the physical features, you may find stomach pain or discomfort, muscle tension, headaches, rapid breathing and heart rate, sweating, shaking and trembling, dizziness, sleep and appetite disturbances, and constant fatigue. Among the cognitive or mental features of anxiety, you may experience difficulty concentrating, your mind often going blank, worry and overthinking, expecting the worst, irrational fears, and thoughts about losing control or going crazy. Among the emotional features of anxiety, you may find restlessness, irrational anger, apprehension, a sense of impending doom or dread, and panic, which is intense fear. On the behavioral side of things, you may see yourself eating or sleeping more or less than usual. You may find that you withdraw from others. You may procrastinate or neglect your responsibilities. You may use substances to relax, or you may show other nervous habits such as nail biting, pacing, or pulling your hair. Normally, the brain manages our fear and anxiety without allowing it to interfere with our daily functioning. If there's a nearby threat, different areas of the brain help us to make sense of this threat by amplifying or toning down our anxiety. Until recently, scientists believed that a marble-sized brain area called the amygdala served as the hub of fear and anxiety. In people with anxiety disorders, scientists thought that inappropriate fear and anxiety were caused by a hyperactive amygdala, a simple cause with a simple effect. Today, though, we appreciate that anxiety is the result of constant chatter between a number of different brain regions, a fear network. No one brain region drives anxiety all on its own. Instead, interactions among many brain areas are all important in how we experience anxiety. As mentioned before, our bodies have a hardwired stress response called the fight-flight response. It acts as a built-in system of protection. It can make us feel like we want to run and hide, or stand up and fight in the face of a perceived threat or danger. When the response works properly, it helps us to stay alert, focused, and energetic when we need to be. It can help us mobilize the energy needed for vigorous action, such as escape from a situation of danger, as pictured here. Our nervous system is, however, not very good at distinguishing between emotional and physical threats that may face us with mortal danger. If you are stressed by academic deadline, your brain may confuse the situation with an actual life or death situation. It will then react accordingly to save you from the threat. If you are in a situation of imminent actual threat, the increased alertness and body response of stress can be life-saving. But if it occurs when you're trying to revise or present a talk, or if it's experienced at such high levels that it paralyzes you or causes errors, it can really interfere. At high and intense levels, anxiety can interfere with your ability to take in information, process it, and store it properly in your memory. So this may hamper learning and remembering. If we experience stress and anxiety frequently, it can start to feel familiar, even normal. You may not notice how much it is affecting you, even when it takes a heavy toll. Chronic stress, the experience of stress and anxiety on an almost continuous basis over a long period of time, has been associated with poor physical and mental health outcomes. Let's take a closer look at anxiety disorders. But how will I know if my anxiety has reached the level where it classifies as an anxiety disorder? Anxiety reaches a clinical level and can be diagnosed as a disorder if it's been present for a very long period of time, usually more than 6 months, and if it significantly impairs your functioning. So if it gets in the way of you doing your academic work properly, it interferes with your social life or your relationships, or it stops you from doing your work properly. An anxiety disorder cannot be diagnosed if your anxiety is there as a side effect of a drug you are taking or a medication. An anxiety disorder can also not be diagnosed if your anxiety is there as a side effect of some other mental or medical condition. In other words, anxiety may qualify as a disorder when it becomes a habit and it impacts your life in a serious way. There are many different types of anxiety disorders. Each disorder carries its own particular constellation of signs and symptoms. They therefore may look and feel very different from each other. People who suffer from anxiety disorders, however, share this feature: a fear of the thoughts, the sensations, and the emotions that go paired with the experience of anxiety. It might be useful to take a closer look at some of the commonly diagnosed anxiety disorders. First, we'll be looking at generalized anxiety disorder, otherwise known as GAD. In GAD, a high degree of anxiety is often accompanied by excessive and long-standing worry about a very broad range of topics. These may include your personal health, the well-being of your family and friends, the state of the world, politics, etc. A person who's experiencing generalized anxiety disorder may often feel like they are on the brink of some disaster in every domain of their life. Their worry may seem disproportionate to the situation they are in. They may feel anxiety and worry a lot, even in the presence of no threat. The person's worry may feel out of control. They may feel restless and on edge all of the time. As a consequence of being anxious all the time, the person may report feeling very fatigued and tired. They may experience muscle pain and stiffness, especially in their neck and shoulders. They may feel that they're unable to concentrate. They may also experience difficulty sleeping. These symptoms make it hard to carry on their day-to-day activities and meet their responsibilities. Panic disorder involves recurrent, unexpected panic attacks. So, this involves short periods of intense fear or discomfort, which develops quickly and then tapers off after a while. A panic attack may last anything from about 10 minutes to an hour. A panic attack usually shows 4 of the following 13 features: a sense of impending doom or danger, a fear of loss of control or death, a rapid pounding heart rate, sweating, trembling or shaking, shortness of breath or tightness in your throat, chills and hot flashes, nausea, stomach cramps, chest pain, headaches, dizziness or lightheadedness, numbness or tingling sensations in your hand, feet, or face, or a feeling of unreality or detachment. Although panic attacks themselves aren't life-threatening, they can be frightening and significantly affect your quality of life. One of the worst things about panic attacks is that they bring about an intense fear that you might experience another one. You may fear having panic attacks so much that you change your behavior, so you may avoid certain situations where the panic attacks have occurred before. Panic attacks can occur on their own outside of the context of any mental health disorder, or they can co-occur with any other mental illness too. Specific phobias involve intense, long-standing fear or anxiety when you're faced with specific objects or situations. This anxiety or fear may seem unreasonable, as it may seem out of proportion to the actual risk of harm in the presence of the stressor. The anxiety and fear is usually immediately evoked by the presence or the anticipation of the specific object or situation. You get different types of specific phobias. Some people may have a fear of dogs. This would qualify then as an animal type of phobia. Some people have natural environment type phobias, including fear of heights. Blood injection injury types would involve a fear of needles or injections, and a situational type might be an intense fear experienced in the context of attending a class at CPUT. Specific phobias are often accompanied by avoidant behavior or extreme distress if a person is forced to be in the presence of their feared object or situation. A specific phobia can really impair your functioning. Agoraphobia. Agoraphobia involves disproportionate anxiety, fear, and distress when a person is exposed to or anticipates certain situations. These situations include public spaces, using public transport, leaving one's house, and crowds. The fear and anxiety in these contexts is centered on the fact that the person feels that help will not be available to them in these situations, or that they'll be unable to escape without embarrassing themselves. Agoraphobia is also often accompanied by avoidance behaviors. It can be very impairing and interfere with everyday aspects of your life. It's often associated with panic attacks and panic disorder. Social anxiety disorder, or social phobia, involves persistent and intense fear or anxiety about social situations. The person usually fears being negatively evaluated by others, or judged, or embarrassed or humiliated. The person may also report that they have concerns about offending other people. The person may avoid social and other performance situations, or otherwise endure it with intense distress. Again, this disorder is very impairing and it will interfere with a person's daily life. It's often associated with low self-esteem, negative thoughts, and depressive symptoms, and also a sensitivity to criticism. Other conditions which may feature prominent anxiety include major depressive disorder. In this disorder, a person may experience a low or depressed or irritable mood, along with lack of interest and pleasure in life. Depression often has a large anxiety component. Another condition which features prominent anxiety includes post-traumatic stress disorder, or PTSD. This condition may occur after experiencing a traumatic event, such as a gender violence incident, rape, a motor vehicle accident, or some other disaster. The person may experience difficulties relaxing, concentrating, and may experience upsetting flashbacks and memories of the traumatic event. The person may also show avoidant behavior to cues which act as reminders of the event. Obsessive compulsive disorder, or OCD, also features a strong anxiety component. A person with this disorder may experience intrusive, unwanted thoughts which cause anxiety. Relief for this anxiety is sought through the performance of certain behaviors or rituals. But what can we do about our anxiety? Let's look at emotion regulation and emotion regulation skills. Emotion regulation refers to a person's ability to effectively manage and respond to emotional experiences. For example, if you found yourself stressed, shaky, and trembling before writing an exam, regulating your anxiety might entail taking some action or engaging with some form of thought which allows you to reach a calmer state of mind. Emotion regulation sounds complicated, but we may already be doing it in some way or form without realizing it. Have you, for example, found that it helps to take a warm bath when you feel really upset? Do you have a favorite type of music which helps you to feel more centered? Does exercise seem to elevate your mood while calming you down? These are some of our everyday forms of mood regulation. It's important to remember a first step in being able to regulate our anxiety is in identifying it. Ask yourself, are you able to identify when you are feeling stressed or anxious? Acknowledging and accepting anxiety. Since anxiety feels so uncomfortable, it's easy to view it as purely unwanted and negative. However, key to better managing anxiety lies in acknowledging and accepting it as within the range of normal emotions. People who are able to identify, acknowledge, and accept their anxiety as neither something good or bad, but just something that is, are better able to devote their energy to their goals and to not be derailed by anxiety. So the key takeaway here really is how we respond to our experience of anxiety can have a huge influence on how it impacts our lives. As noted before, avoidance is a common behavior when anxiety strikes. Avoidance may bring immediate relief in the face of an anxiety-provoking situation. Unfortunately, it also makes the situation or the thing that we're avoiding more difficult to approach in the long run. Regardless of the initial cause, all anxiety is sustained and worsened by some form of behavioral or cognitive avoidance. Eliminating habits of avoidance is therefore the key to better managing anxiety. Instead of avoidance, learning to cope through approach or acceptance rather than avoidance may be necessary. Is it possible that worrying can be a form of avoidance? Worrying may feel a lot like problem solving. It gives us the illusion of control and the hope that we can make things better. Unfortunately, it serves a different purpose, namely distraction. Worry is a mental activity that keeps our mind off the difficult feelings we may be feeling, such as anxiety. It lets us avoid these feelings by thinking about the perceived problem. Unfortunately, by avoiding the feelings of anxiety and the symptoms of the fight or flight response, we are teaching our brain that they are dangerous and threatening to our survival. Mindfulness for anxiety. Mindfulness training gives you tools to help you remain calm, sustain your attention, and be able to focus. It teaches you and allows you to practice identifying, acknowledging, and accepting difficult emotions such as anxiety in the face of academic and other stressors. It does this by helping you to pay attention to the present moment through simple breathing and meditation practices, which increase awareness of thoughts and feelings so as to reduce stress and anxiety and boost levels of attention and concentration. This may sound like New Age mumbo jumbo. Well, it isn't. There's a growing body of empirical evidence showing that it is effective. You do, however, need to practice for the best results. You may ask, but how do I identify, acknowledge, and accept my anxiety? Try to turn towards your anxiety with acceptance. Become aware of the emotion and try to establish where you're experiencing it in your body. It might help to look at the list of anxiety features that we covered before. Try to identify and label the emotion. Say to yourself, this is anxiety that I feel. Don't try to convince yourself otherwise. Don't deny the emotion. Acknowledge it and that it's there and try to accept it. Remind yourself that anxiety, as all feelings, are not permanent. Even if it feels overwhelming, it will pass. Inquire and investigate. Ask yourself, what triggered me? Why do I feel this way now? Try to let go of the need to control the anxiety. Be open to the outcome of your emotions. See where it goes, and eventually see how it passes. Try to allow your anxiety to be present without trying to make it go away. So stand tall, breathe, allow yourself to feel it. Accept that this too is a moment in your life. You might not instantly stop being anxious, but the point of mindfulness is not to ignore unpleasant feelings, but rather to sit with them. This way, you can stop obsessing over trying to change them and focus more on why you're feeling that way and getting on with the task at hand. Here's another emotion regulation tip. It's important to note that changing thoughts may be easier than changing feelings. Thoughts play a critical role in how we experience situations, internal experience, and sensations. If you notice yourself growing increasingly anxious, Try to evaluate what you're thinking. It's likely that your thoughts are fueling the anxiety. Examples of such thoughts might include, I'm such an idiot, or I can't cope with this, or what if I fail this, I'll fail the year, or what if I embarrass myself. Ask yourself what evidence you have to support these thoughts and what evidence you have to counter these thoughts. Weigh up the evidence and try to come to a more balanced and realistic perspective. Here are some things you can tell yourself when you are feeling anxious. These represent more balanced and realistic thoughts to replace anxiety fueling thoughts. My brain is giving me the wrong signals. I am safe. I'm learning how to cope. I trust myself. This feeling won't last forever. Thank you for the warning, brain and body, but I'm okay. I accept this feeling. I've felt this way before and nothing bad has happened. I'm learning to manage my feelings in a healthy way. Anxiety won't stop me from doing the things I want. I don't have to do this alone. I can ask for help. Self-care is important in learning how to manage your anxiety. Try to learn about anxiety. In order to overcome anxiety, it's important to understand the problem. Cultivate your connections with other people. Loneliness and isolation set the stage for anxiety. Decrease your vulnerability by reaching out to others. Make it a point to see friends. Try to join a self-help or support group, or share your worries and concerns with a trusted loved one. Set some time aside every day in which to worry, or write down your worries and keep them in a particular place. Try to get enough sleep. Consider your diet and your intake of stimulants. This will keep your blood sugar stable. The effects of stimulants, such as caffeine, can mimic the effects of anxiety. Try to build physical activity into your schedule. Exercise is beneficial to your mental well-being. Breathing exercises can help you to feel calmer and more settled. Keep a diary. This might help you to identify patterns or specific triggers. You can also note what's going well for you, what you have achieved, and where you have improved. Living with anxiety can mean you think a lot about things that worry you or are hard to do. It's important to be kind to yourself and notice the good things too. Try to reduce your life stresses. Getting professional help. It might be a good idea to get professional help if your anxiety is persistent, meaning that it's present for weeks rather than a few hours or a day or two, or if your anxiety involves impairment in functional, social, occupational, academic, or familial functioning. So, for example, if your anxiety makes you unable to complete assignments or meet your work responsibilities, or due to attempts to avoid the anxiety, you face impairment. You may also need to get professional help if you feel that your anxiety is distressing, meaning that it causes you to feel persistently down about yourself and your abilities. And also if your anxiety is leading you to considering self-harm or suicide. A good place to start is with your family doctor, general practitioner, or local primary health care clinic. The counselors at CPUT Student Counseling will be able to assess and assist in the event that you feel you meet the above criteria. A list of resources will be provided at the end of this PowerPoint. What are the treatment options for anxiety? Talk therapies or psychotherapy. Psychotherapy or therapeutic counseling is often the most effective option in treating problematic anxiety. Psychotherapy treats more than just the symptoms of the problem. It can help you to uncover the underlying causes of your worries and fears. It can help you to learn how to regulate your emotions more effectively. It can help you to reframe situations in a new, less frightening way. Psychotherapy may provide you with the tools to better manage anxiety and live your life in a more satisfactory way. Psychotherapy should be tailored to your specific symptoms and diagnoses. It's important to see a fully qualified psychologist or counselor. Medication. Anti-anxiety medications have physical effects on the brain and the body, which can help reduce the symptoms of anxiety such as worry, fear, and panic attacks. These medications must be prescribed by a doctor and often by a psychiatrist. Anti-anxiety medications are not cures for anxiety disorders, but they can help manage some symptoms over the short term. There are a number of different anti-anxiety medications available. The right medication for you depends on your type of anxiety disorder or issue and whether you have other health problems or take any other medications. Often, a combination of approaches is needed to alleviate your symptoms and maintain your sense of well-being. If you feel you need help or more information, please contact one of the following: